Here are some important facts that you should know about the so-called science of psychiatry. Mental disorders are voted into and out of existence based on factors that have nothing to do with medicine. In fact, psychiatry admits that it has not proven the cause or source of a single mental illness. The theory that a chemical imbalance causes mental illness has been thoroughly discredited by the psychiatric industry itself. While psychiatrists claim that brain scans can detect certain mental disorders, there is no scientific proof, and medical experts say that to even suggest this is true is unethical. In legal matters, psychiatrists rarely agree in their diagnoses of a witness or defendant on whether or not he'll commit another crime. Numerous studies show that undiagnosed physical problems can cause behavioral and emotional problems, and that psychiatrists routinely diagnose these physical conditions as mental disorders. In 2003, the Psychiatric Times published an article calling psychiatry's diagnostic manual a laughing stock for the other medical specialties. And using that same laughable diagnostic manual, 17 million children worldwide, the majority in the U.S., are now prescribed some form of unpredictable psychotropic drug for mental illnesses, none of which have been scientifically proven to even exist. An apparent medical specialty that creates and uncreates illnesses by a show of hands, uses opinion instead of medical tests to diagnose a patient, openly admits it doesn't know what it's treating or how to cure it, puts tens of millions of children and adults on dangerous addictive drugs with life-threatening side effects, and has to use threats, coercion, and police power to get patients to comply with treatment, cannot be called a science. My name is Dave Figueroa. On this installment of the TV edition of Freedom Magazine, we will clearly show that psychiatry is, in fact, a pseudoscience. Imagine a medical doctor treating high blood pressure or diabetes who can't even define what it is. Now consider that not one psychiatrist can medically define what he supposedly is treating. And here's why. Since psychiatry is not based on science or even on medicine, but on behaviors that people find bothersome or troublesome, it had to create a way to label those behaviors as diseases. In 1952, a group of psychiatrists from the APA, the American Psychiatric Association, got together and decided to write a manual on how to diagnose mental illnesses and subsequently bill for them. This book is called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM for short. It started off with 112 mental disorders, which seems unbelievable in itself. But then in 1968, they revised it and added over 50 newly discovered mental illnesses. Then in 1980, they revised it again, and the number of mental disorders then totaled 224. By the way, this is the edition where they literally voted attention deficit disorder into existence with a show of hands. Those of you who believe that it exists, raise your hands, and if we have enough votes, we'll include it in the manual. That's the science behind ADD. 1987's edition listed 253 mental disorders, and the most recent edition, published in 1994, lists 374 mental disorders that we as adults or children supposedly suffer from. Have you ever heard of the following mental disorders? Reading disorder, disruptive behavior disorder, mathematics disorder, nicotine dependence disorder, or physical abuse of a child problem, or sexual abuse of a child problem, or if you don't want to take your psych meds, non-compliance with treatment disorder. These are behaviors, and some of them are criminal behaviors. There is no medical science that can identify any of these behaviors as diseases. Psychiatry has labeled, medicalized, and stigmatized virtually every behavior we as humans can exhibit. Now, because of Psychiatry's diagnostic manual, the DSM, and the promotion of these bogus illnesses, feeling very sad has become depressive disorder. Worrying too much is anxiety disorder. And being stubborn, orderly, and a perfectionist is obsessive-compulsive disorder. Excessive gambling, drinking, drug use, or eating are also now illnesses. Beating people up is intermittent explosive disorder. And now even young children who are very shy and who are afraid of public speaking supposedly suffer from social anxiety disorder. Psychiatric diagnoses are a combination of social engineering and what's good for business. In 1973, APA committee members voted to cease calling homosexuality a mental disorder after gay activists picketed the APA conferences, so they took it out of the DSM. But that left those gay men and women who actually had a problem with being gay. So they created for them ego-dystonic homosexuality, which is the first mental illness that is only a mental illness if you think it is. Now, if mental illness were really an illness in the same sense that physical illnesses are illnesses, the idea of deleting homosexuality or anything else from the categories of illness by having a vote would be as absurd as a group of physicians voting to delete cancer or measles from the concept of disease. It just doesn't make sense. And convincing the public that it is fraud. But the DSM has become so widely relied upon within society that it has taken on the aura of scientific fact. Millions now use and believe in its diagnostic abilities, never once suspecting that the whole premise and the system itself are fraudulent. These people are at risk of making seriously wrong, even fatal decisions in either their own lives or the lives of others. Making lists of behaviors and then applying medical-sounding labels to people who engage in these behaviors is meaningless. It tells us nothing about causes or solutions. It does, however, create the illusion that something medical is going on. And that fraudulent illusion is the definition of a pseudoscience. The cornerstone of psychiatry's disease model today is the theory that a brain-based chemical imbalance causes mental illness. As with all of psychiatry's mental disease models, it has been thoroughly discredited by researchers, psychiatrists, psychologists, and medical doctors. Diabetes is a biochemical imbalance. The biochemical imbalance is a high blood sugar balance level. Treatment in severe cases is insulin injections, which restores the sugar balance. The symptoms clear up, and when you retest, it shows the blood sugar is normal. Nothing like a sodium imbalance or blood sugar imbalance exists for depression or any other psychiatric syndrome. In 2002, Dr. Thomas Szasz, professor of psychiatry emeritus, stated, "There is no blood or other biological test to ascertain the presence or the absence of a mental illness, as there is for most bodily diseases. If such a test were developed, then the condition and the behaviors would cease to be a mental illness and would be classified instead as a symptom of a bodily disease."